Hello, my dear friends. Dr. Mandell here. I hope you're having a beautiful and blessed day. And if you're dealing with kidney issues, or if you're already on dialysis, this video might just change your life. Today, we're talking about something critically important. Vitamins, yes. Those little capsules or tablets you think are helping you, but some of them may actually be causing more harm than good, especially to your kidneys. So many people take supplements every day without understanding their impact, especially when it comes to kidney health. But your kidneys are delicate, and when they're struggling, some vitamins can become toxic. Today, I'll reveal 4 dangerous vitamins you should avoid at all costs. Lift your knee up like this, and 4 you absolutely need to take if you want to help your kidneys function better and possibly even prevent or slow down dialysis. I want to talk to you from the heart today. This is something that's not just important, it's life-changing. If you or a loved one are dealing with kidney problems or already on dialysis, you must listen closely. So many people out there are doing what they believe is right, taking their vitamins, doing their supplements, thinking they're helping their bodies. But I'm here to tell you something that might shock you. Not all vitamins are safe, especially if your kidneys aren't working the way they should. Now, let me make this very clear. Vitamins are essential to life. We need them to function, to heal, to grow, and to survive. But when your kidneys are impaired, your body cannot handle vitamins the way it normally does. Your knee up like this. In particular, fat-soluble vitamins like vitamin A and vitamin E can become extremely dangerous. And you may not even realize it because the damage is happening quietly inside your body. No pain. No alarm bells, just a slow toxic buildup. Your kidneys scream for help. Let's talk about vitamin A first. Most people take this vitamin for their eyes, their immune system, and their skin. It sounds great, right? But here's the truth. Vitamin A is fat-soluble, meaning it does not dissolve in water. It's stored in your liver and fat tissue, not flushed out like water-soluble vitamins such as vitamin C or the B complex. So if your kidneys are working only 30%, 20%, or even 10%, they are not filtering your blood the way they should. This causes vitamin A to accumulate in the body to levels that can be toxic. You may start experiencing things like headaches, dizziness, dry skin, nausea, and even liver damage. And here's the worst part. People on dialysis often aren't told about this. They think a multivitamin is harmless. But for someone with chronic kidney disease, especially in stages 3 to 5, vitamin A can silently harm the body while you're thinking you're doing something healthy. Now let's talk about vitamin E, another fat-soluble vitamin. This one is known as an antioxidant. Good for the heart, great for the skin, often used to support the immune system. But again, the same danger applies. Your kidneys, when functioning normally, help maintain the balance of nutrients in the bloodstream. When they're impaired, vitamin E is not eliminated properly and can build up over time. And too much vitamin E can interfere with blood clotting, which can lead to bleeding problems, especially dangerous if you're on blood thinners, which many kidney patients are. Like this. You see where I'm going with this. These vitamins, when taken without guidance, can cause more harm than good. And this is where I get emotional. Me up like this because I've worked with thousands of patients over the years who are trying to help themselves, but we're unknowingly making things worse. Not because they didn't care, because no one warned them. It's not your fault. You weren't told. You didn't know that when the kidneys are impaired, they can't regulate and excrete certain vitamins effectively, and doctors don't always have the time to go over each supplement. That's why I'm here. That's why I make these videos. Because knowledge is power. And once you have it, you can take your health into your own hands. Let's talk about another one. Vitamin C. Now this one is water soluble. So it gets flushed out more easily. But when you take high doses, and I mean 1,000 mg or more daily, your body converts it into oxalate, a compound that your kidneys need to remove, like this. But with damaged kidneys, oxalate can build up, leading to calcium oxalate crystals, which can cause kidney stones and even further damage kidney tissue. That's why even something like vitamin C, like this, which we all think of as harmless, can become a real problem in the wrong dose for someone with kidney disease. So what should you do? Number 1, you must understand that not every vitamin is safe for everyone. If you're dealing with kidney disease or on dialysis, you need to be especially careful with fat-soluble vitamins. This, mega doses of supplements and anything not prescribed by your nephrologist or renal dietitian. Number 2, read your labels. This, multivitamins that are made for the general public often include doses of vitamin A and E that are too high for kidney patients. You want to look for renal safe multivitamins, knee up like this, which are formulated without these harmful levels. These are designed specifically for patients with reduced kidney function and won't overload your system with what it can't handle. This. Number 3, talk to your healthcare provider. I know that sometimes it feels like doctors don't have the time to listen or explain, but ask anyway. Bring in your supplements. This, show them what you're taking. Ask, is this safe for my kidneys? You'd be surprised how many people take herbal products or high-dose vitamins without ever checking if they're safe. This. Let me tell you a quick story. A patient of mine was taking a high-potency multivitamin with double the daily dose of vitamin A and E. He was on stage 4 kidney disease. He came in with headaches, fatigue, and blurry vision. Blood tests showed elevated liver enzymes and dangerously high vitamin A levels. We stopped the multivitamin immediately. And over the next few weeks, his symptoms improved, his labs normalized, and we preserved some of his kidney function. All from removing what was supposed to be a harmless vitamin. I say this to remind you this. You are in charge of your health. No one else. Your body is your temple. You must protect it, please. Don't just take a vitamin because you saw an ad or your friend said it helped them, or it worked for someone else. What's good for one person can be harmful for another, especially when it comes to the kidneys. So remember vitamin A, vitamin E, and high-dose vitamin C. These are not your friends if you have kidney disease. In fact, they can be your enemies, And your kidneys are already working so hard. Don't give them more of a burden. Give them a break. Give them support. Remove what's harming them and give them what they need to thrive. You don't have to be perfect. You just have to be informed. And that's what we're doing here together, learning, healing, and taking back our power one step at a time. I want to continue this very important discussion we started, something that could literally save your kidneys from further damage. You see many of you watching right now are either in the early stages of kidney disease or already on dialysis and you're trying to make good choices. You're taking your vitamins, drinking more water, eating a little cleaner, and that's beautiful. That's progress. But what if I told you that something as simple as taking too much vitamin C could be silently hurting your kidneys? That's right. And I know some of you may be surprised to hear this because we've been told over and over again how important vitamin C is. We associate it with immunity, wound healing, collagen production, even protecting us from the common cold. And while all of that is true, vitamin C is necessary for human health. The problem arises when we overdo it, especially when the kidneys are compromised. Let me explain this in a simple way. When you take vitamin C, your body uses what it needs, and the rest gets broken down and filtered out, ideally by the kidneys. Now, if your kidneys are healthy, they'll remove the excess through your urine. But when your kidney function is reduced, or you're on dialysis, that filtration system is no longer working properly, and here's what happens next. That excess vitamin C is converted into a substance called oxalate. Now, oxalate is not something you want hanging around in your body. It binds with calcium and forms calcium oxalate crystals. And guess what that leads to? Kidney stones. Not only are kidney stones painful, they can cause even more trauma to kidneys that are already struggling. And if your kidneys are already damaged or you're on dialysis, these oxalate crystals can deposit right into the kidney tissue, making things even worse. And here's something that people don't often realize. When you're on dialysis, you might think the machine is doing all the work, filtering everything out, removing all the bad stuff, but that's not entirely true. Dialysis is a wonderful life-saving treatment, but it doesn't do everything your kidneys would normally do. And one of the things it's not particularly efficient at is removing oxalate. So what does that mean for you? It means that taking high doses of vitamin C, 500 meg, 1000 G, sometimes even more per day, can lead to a dangerous buildup of oxalates that your kidneys simply cannot handle. I've seen patients who are taking mega doses of vitamin C to boost immunity during cold and flu season, and instead they ended up with worsened kidney function, and in some cases, this hospitalization from kidney stones or oxalate nephropathy. That's oxalate damage to the kidneys. Let me give you a picture here. Think of your kidneys like coffee filters. This. When they're healthy, the filter is clear, clean, and lets water pass through easily while catching the bad stuff. Now imagine pouring a full scoop of sugar or sand into that filter. What happens? This. It clogs. It slows down. The liquid starts backing up. That's exactly what oxalates do to your kidneys when they build up. And your body starts suffering. Fatigue, swelling, nausea, and worse, this. Now you might be thinking, well, Dr. Mandell, what's the right amount then? Should I avoid vitamin C altogether? And that's a great question. This. The answer is no. You shouldn't completely avoid it because your body still needs it. But the key is in the dosage and source. This. The recommended dietary allowance our day for vitamin C in adults, about 60 or 90 mg per day. And even in people with CKD or on dialysis, knee up like this. Moderate amounts, 100 mg per day, are usually considered safe. That's a far cry from the 1,000 mg tablets you'll find on store shelves. This, or the immune boosters that are flooding the market. This is why working with a knowledgeable physician or renal dietitian is so crucial. They can help determine what levels are safe for you personally based on your kidney function lab results and overall health. Now let me share a quick story with you like this. I had a patient, let's call him Joe. Joe was in his 60s, had stage 3 chronic kidney disease and wanted to be proactive about his health. He read online that high-dose vitamin C could flush toxins from the body and boost the immune system. So every morning he took 2,000 mg of vitamin C powder mixed in water. After about 3 months, Joe started having lower back pain, severe fatigue, and noticed blood in his urine. After some testing, we found out he had developed large calcium oxalate kidney stones. And worse, his creatinine levels had doubled. That means his kidney function took a sharp dive. We immediately stopped the vitamin C, increased his hydration, supported his body with appropriate nutrients, and referred him to a nephrologist. Fortunately, we were able to manage the damage like this. But he could have avoided it altogether if he had understood the dangers of excess vitamin C in kidney disease. Let me tell you something important. More is not always better. We live in a world where we think if a little is good, a lot must be great. That's a dangerous mindset, especially when it comes to supplements and damaged organs. Vitamin C in reasonable amounts, this is beneficial. It supports your immune system, helps with wound healing, and even protects against oxidative stress. But in large doses, particularly if your kidneys can't handle the load, it becomes toxic. That's why I always say, take what the body needs, not more, not less. Just what is required for balance. This is what true healing looks like. Giving the body exactly what it needs to do its job without overwhelming it. We need to respect our bodies, especially when an organ is compromised. And if you're living with chronic kidney disease, your kidneys are already working overtime. Don't make their job harder by flooding them with substances they can't eliminate. So what can you do right now? Number 1, check your supplement labels. Look at how much vitamin C you're taking daily. If you're taking anything over 102 mg per day and you have kidney issues, it's time to have a talk with your doctor. Number 2, be cautious with immune boostings and powders, especially those used during flu season. Many contain very high doses of vitamin C, zinc, and other ingredients that can put additional strain on the kidneys. Number 3, stay hydrated. Oxalates are less likely to form crystals in a well-hydrated body. So drink that clean, filtered water throughout the day, sip by sip. Number 4, if you need vitamin C, try to get it from natural food sources like bell peppers, berries, and broccoli in moderation. These whole foods come with fiber and other nutrients that help the body metabolize vitamins more gently and safely. And finally, number 5, educate yourself. Learn how your kidneys function. Understand how your body processes what you put into it. Take responsibility. No one can care for your health like you can. You have that power, and I believe in you. I hope this message gives you clarity and direction. You're not alone on this journey. Every step you take toward protecting your kidneys is a step toward a healthier, fuller life. I hope this message finds you well in good spirits today. I want to continue our vital conversation about kidney health, and specifically dive into some of the most important vitamins that your body absolutely needs, especially if you're living with chronic kidney disease or on dialysis. Now, I've already told you about the dangers, the vitamins that can build up and become toxic. But let's not forget something just as important. The nutrients that your body starts to lose when your kidneys stop functioning properly. These losses can lead to serious problems, weakness, fatigue, nerve issues, poor immunity, even heart problems. But here's the beautiful part. You can give your body the support it needs through the right kind of supplementation. The key is knowing what to take and why. Let me be clear. When your kidneys are not doing their job, whether you're in stage 3, 4, or 5 of kidney disease, or you're already on dialysis, your body becomes vulnerable to nutritional deficiencies. And I don't just mean low energy or feeling a little tired. I'm talking about a breakdown in the essential functions of your body. That's why replacing certain vitamins becomes absolutely essential. Let's start with vitamin B1, also known as thiamine. Thiamine is responsible for helping your body convert food into energy. Think of it like the spark plug in your engine. Without it, the whole system slows down. People on dialysis often lose thiamine through the dialysis process. And deficiency can lead to serious fatigue, nerve damage, and even heart problems. Your body doesn't store thiamine long term, so you must keep replenishing it, especially if you're filtering your blood through a dialysis machine multiple times a week. Thiamine also supports brain health and nerve function. 2 areas where many kidney patients begin to struggle. I've seen patients who were simply exhausted, forgetful, emotionally drained, and their labs showed very low thiamine levels. Within weeks of proper supplementation in safe balanced amounts, their clarity returned, their energy came back, and they started to feel like themselves again. That's the power of this vitamin when used correctly. Next, let's talk about vitamin B12 or cobalamin. Now, this one is crucial, absolutely critical for everyone, but especially for kidney patients. B12 is necessary for the production of red blood cells, the ones that carry oxygen throughout your body. Without enough B12, you may become anemic, which is common in kidney disease. When you're anemic, you feel drained, you're short of breath, your muscles feel weak, your brain feels foggy. Sound familiar? Now here's the twist. Many people are taking B12 in their regular multivitamin, but guess what? They're still deficient. Why? Because kidney disease affects how your body absorbs and uses B12. Also, the loss of intrinsic factor in the stomach and other absorption issues can prevent the B12 from doing its job. That's why it's often necessary to take higher quality, more absorbable form, sometimes even as an injection or under the tongue lozenge, especially in dialysis patients. When your B12 levels are in check, something amazing happens. Your energy increases, your mood improves, and your nerves stop tingling or burning. I've seen patients who were on the verge of quitting their physical therapy or exercise routine because they had no stamina. And after restoring their B12, they were back in the gym, walking stronger, standing taller. That's how much of a difference it makes. Now, let's move on to something we don't talk about enough in kidney health, vitamin D. Specifically vitamin D3, the active form your body needs. You see, the kidneys are responsible for converting vitamin D from its inactive form, D2, into its active form, D3. So if your kidneys aren't functioning well, your body won't be able to make enough active vitamin D, and that leads to a cascade of problems. First, your bones become weak. Vitamin D is essential for calcium absorption, and without it, your bones start losing density. This is why so many people with CKD suffer from bone fractures, pain, and even a condition called renal osteodystrophy. But it doesn't stop there. Low vitamin D also weakens your immune system, increases inflammation, and can make depression and fatigue much worse. Supplementing with the right form and dosage of vitamin D3 under medical supervision can help restore your balance. And when your vitamin D levels are restored, you'll notice better muscle function, improved mood, reduced bone pain, and fewer infections. It's incredible what a little sunshine vitamin can do, especially when your body is struggling to make it naturally. And now, let's talk about one more vitamin that kidney patients often forget about, but it's absolutely vital: folic acid, or vitamin B9. Folic acid plays a key role in cell growth, DNA repair, and most importantly, red blood cell formation. When you're on dialysis or living with CKD, your body can easily become deficient in this essential vitamin. Especially because it's water soluble and often lost through the dialysis process. Low folic acid contributes to anemia just like B12, but also affects your heart health. You see this. Without enough folic acid, a substance called homocysteine builds up in the blood. High homocysteine levels are linked to heart disease, stroke, and blood vessel damage. That's not something you want to mess around with, especially when your kidneys are already under stress. Folic acid also supports brain function and helps reduce the risk of cognitive decline, which is very common in older adults and kidney patients. So when you include the right amount of folic acid, again, guided by your healthcare team, you're giving your brain and body the support they need to stay sharp and strong now. Let's be practical like this. I don't want you running out and buying 10 different bottles. That's not the point here. The goal is to understand that there are renal-friendly vitamin supplements designed specifically for people like you. People with compromised kidney function who still need proper nutrition. These supplements are low in harmful fat-soluble vitamins like an E and high in the supportive B, vitamins D, and folic acid that your body needs to thrive. You might be thinking, Dr. Mandell, why don't doctors tell us this more often? And that's a good question. The truth is, many doctors are focused on managing labs, prescriptions, dialysis schedules, and emergency care. They don't always have time to explain nutrient balance. That's where you come in. By educating yourself, you can become your own best advocate. When you understand that your kidneys filter not just waste, but nutrients too, you begin to appreciate how delicate and powerful the system is. And when that system breaks down, you need to rebuild it with intention, not with guesswork. That's why I'm here, to remind you that you have more power than you think, that healing is possible, that the right vitamins in the right amounts can reduce fatigue, protect your heart, support your bones, strengthen your nerves, and restore hope in a body that's fighting to heal. Take this seriously. Talk to your healthcare provider. Ask them what levels are right for you. Get your labs checked regularly. And above all, take responsibility for your health, because no one else can do it for you. You're not alone. You're not broken. You're in a healing process like this, and every single step you take, even choosing the right vitamin, brings you closer to a better life. I want to speak to you from the heart today about something that is so important yet so misunderstood, and that is the belief that just because something is labeled natural, it must be safe. Let me tell you right now, that is not always true, especially when you're dealing with chronic kidney disease or dialysis. In fact, like this misunderstanding is putting a lot of people in danger without them even knowing it. We live in a world today where supplements and herbal products are everywhere. You walk into a grocery store or pharmacy, and there's an entire aisle full of colorful bottles promising everything from better sleep to stronger immunity, glowing skin, sharper memory, and more energy. And many of them say things like all natural, plant-based, or herbal. But my friends, I want you to know, just because it comes from a plant or says organic or natural does not mean it's safe for someone with impaired kidney function. Your kidneys are your body's filter. They're responsible for removing waste, balancing fluids, and clearing out excess substances, including medications and supplements. When your kidneys are not working well, they can't process things the same way they used to. And what happens? Those substances start to build up. That's when toxicity happens. That's when the damage begins. That's when something you thought was helping you can actually become your worst enemy. Let me give you a very common example. Vitamin B6 sounds harmless, right? It's essential. It helps with brain function, nerve health, metabolism. But what if I told you that in high doses, especially through megadose supplements or energy boosters, vitamin B6 can cause nerve damage. And for someone with kidney disease, your ability to clear out excess B6 is already reduced. So when you keep taking more and more thinking you're doing something good for your body, it can quietly start damaging your nervous system, leading to numbness, tingling, even loss of coordination. I've seen it happen. A patient came to me once complaining of pins and needles in her hands and feet. She thought it was neuropathy from diabetes. But after reviewing her supplement list, I discovered she was taking 3 different energy blends, all containing high levels of vitamin B6. When we stopped them and supported her recovery, her symptoms improved within weeks. That's just one example. Let's talk about herbal remedies, which are even trickier. Take licorice root, commonly used in teas, capsules, and herbal blends. Licorice might sound innocent, but it can cause potassium levels to drop dangerously low, raise blood pressure, and stress the kidneys even further. And if you're already on blood pressure medications or diuretics, it can throw your whole system into chaos. Or how about Yohimbe, an herb used for boosting energy and libido? Sounds exciting, right? But Yohimbe can cause high blood pressure, rapid heartbeat, and kidney damage. It's been linked to acute kidney failure in some cases. And yet it's still available over the counter in some energy and weight loss products. Another dangerous herb, aristolochic acid, found in some traditional Chinese herbal blends. This one is especially dangerous. It's been directly linked to permanent kidney failure and cancer of the urinary tract. This isn't just risky, it's deadly. And unfortunately, many people take these blends not knowing what's actually inside them. They trust the label, they trust the word natural. But the truth is, these products are not regulated the same way prescription drugs are. You don't always know what you're getting, and that's why you have to be extra cautious. And here's what I really want you to understand. When your kidneys are not filtering well, even safe levels for the average person can become toxic for you. Your body cannot flush these substances out, so they build up, and the damaged compounds over time, your knee up like this. And the worst part is there are usually no early warning signs, no pain, no alarm bells, just a slow decline in kidney function, until suddenly your labs show a rise in creatinine or a drop in GFR, and you're wondering what went wrong. Now let's talk about the supplement industry for a moment. It's a multi-billion-dollar business, and while there are reputable companies out there doing things the right way, many are not. There are products being sold online and in stores that contain undisclosed ingredients, poor quality raw materials, and dangerously high doses of certain compounds. And they're being marketed to seniors, to people with chronic illness, to people who are desperate for healing and hope. That's why I say, you must become your own health advocate. Read every label. Don't just trust marketing words like natural, pure, or doctor approved. Ask your nephrologist, your renal dietitian, your pharmacist. Is this safe for my kidneys? Bring your supplements to appointments. Go over them one by one. You'd be shocked how many kidney patients are taking 5, 6, even 10 supplements that are either unnecessary or harmful. Now, I'm not saying all supplements are bad like this. There are many vitamins and minerals that are extremely helpful for kidney patients, like B-complex vitamins, vitamin D3, folic acid, and iron when used properly. But the key is taking the right ones in the right amounts under the right guidance. I've had patients who thought they needed to detox their body, so they started taking colon cleansers, your knee up like this, detox teas, and liver flushes. They thought they were helping themselves. But those products contain diuretics, laxatives, knee up like this, and herbs that increase urine output, which further dehydrated their kidneys and accelerated their decline. One man even ended up in the emergency room from an electrolyte imbalance after taking a so-called natural cleanse. Please don't fall for the hype. Healing is not about extreme cleanses or mega doses of mystery pills. Healing comes from consistency, nourishment, proper hydration, and smart, targeted support for your body. Your kidneys are precious. They're doing everything they can to keep you alive. Don't overload them with things they can't process. The good news is, once you remove the harmful supplements and focus on safe, supportive ones, your body has an amazing ability to bounce back. I've seen kidney function stabilize. I've seen energy return. I've seen people get off dangerous medications just by cleaning up their supplement routine. You are not powerless. You don't have to be afraid. But you do need to be informed. Don't just trust the bottle. Trust your research, your education, and your common sense. Ask questions, read, learn. You deserve to know what you're putting into your body because your life depends on it. So my message to you today is don't assume natural means safe. That label is not a guarantee, especially when it comes to your kidneys. Respect your body. Respect your kidneys. And remember that the best healing happens when we work with our bodies, not against them. I want to close this life-changing conversation with something I believe is the most powerful truth you can carry with you. You have more control over your health than you think. Especially when it comes to your kidneys, especially if you're already dealing with chronic kidney disease, or you've started dialysis, or you're trying to avoid it altogether, you're not powerless. In fact, the choices you make today, tomorrow, and every day after that can absolutely affect the direction of your health journey. I've had patients walk into my office feeling defeated. They say, Dr. Mandell, my doctor told me there's nothing more I can do. My kidneys are declining. Dialysis is inevitable. And I look them straight in the eye and I tell them the truth in there's always something you can do. Always. The key is understanding where you do have control. And that starts with your daily habits, your nutrition, your supplements. And yes, like this, even the vitamins you choose to take or avoid. Let me remind you that your kidneys are not passive organs. They're not just sitting there waiting to fail. They are working 24 hours a day, 7 days a week, filtering your blood, removing toxins, balancing minerals, regulating hormones, producing red blood cells. Your kidneys are warriors. They are fighting for you every single second, and the moment they start to weaken, they don't give up. They try to adapt, they try to compensate, they try to survive But if we overload them with the wrong substances, whether that's excess protein, high sodium, processed foods, or dangerous vitamins and supplements, we make their job harder. We make their fight more difficult. Now here's the beauty of it. When we remove the burden, when we stop the toxic vitamins, the unnecessary herbal remedies, the megadoses that serve no purpose, we give those kidneys room to breathe. And that's when the body can start to stabilize. That's when inflammation can reduce. That's when filtration improves. That's when you start to see hope return to your lab results. This is what I've witnessed in patients over and over again. And this is what I want for you. But here's something I want you to hear loud and clear. Your doctor is not your only answer. Your prescription is not your only solution. You and only you decide what goes into your mouth. You decide what supplements you take. You decide whether to educate yourself or blindly follow marketing. That's the reality. There are so many people walking around today with a drawer full of supplements they bought because someone online told them it would cure everything. And yet they're more tired, more swollen, more confused, more sick. Why? Because no one told them that their kidneys were filtering less and less, and all those vitamins they were swallowing were slowly building up, not helping them heal. Let me give you a real example. A woman in her 70s came to me after being told her GFR was down to 25, that's stage 4 kidney disease. She was scared, overwhelmed, and confused. She had been taking a multivitamin, a super greens powder, a turmeric supplement, and a high-dose vitamin C drink every morning. Her friend recommended it, and she thought it was helping her stay strong. But when we looked closer, those products contained excess vitamin A, much of potassium, oxalate-rich herbs, and megadoses of fat-soluble vitamins. Her kidneys were screaming for help, and she didn't even know. We immediately stopped everything except a renal safe multivitamin, adjusted her diet, improved her hydration, and gave her time. Within 3 months, her lab stabilized, her GFR held steady, her energy returned, and most importantly, she regained confidence in her ability to protect her own body. Up like this. That's what I want for you. That's what this is all about. My friends, I know how frightening it is to hear the word dialysis. I know how helpless it feels when you're told that your kidneys are declining. But I want you to remember something powerful like this. Declining is not the same as done. You have time, you have options. You have a window to act right now. And where do you begin? Start by removing the harmful vitamins. Get rid of high-dose vitamin A, vitamin E, excessive vitamin C, and mystery herbal products. Start replacing them with renal-friendly nutrients that are safe and supportive B1, D12, D3. Folic acid in proper doctor-approved doses. Don't go it alone. Talk to your healthcare team, but take charge of that conversation. Show them what you're taking. Ask questions. Get involved. Next, take a look at your food. Your kidneys love fresh, whole foods that are low in sodium, phosphorus, and potassium depending on your stage of disease. Learn to read food labels. Hydrate throughout the day with clean water. Cut out sugary drinks and artificial sweeteners that put more stress on your system. You don't have to be perfect, just consistent. Third, listen to your body. Fatigue, brain fog, tingling in the limbs, changes in urine. These are all signs your kidneys are talking to you. Don't ignore them. Don't push through them. These symptoms are your body's way of asking for help. And finally, never underestimate the power of your mindset. So many people decline faster than they should, not because their body gave out, but because they gave up. They were told nothing could be done, and they believed it. But I'm here to tell you this. As someone who's worked with thousands of patients, there is always something you can do. Maybe it's as simple as changing your vitamin routine. Maybe it's eliminating one harmful supplement. Maybe it's learning how to cook a renal-friendly meal. Maybe it's asking your doctor one more question. These small steps done consistently, are what build lasting change. The message I want to leave with you is this: you are not your lab results. You are not your diagnosis. You're not just a number on a screen. You are a living, breathing, powerful human being who is capable of turning things around. Every step you take in the right direction, no matter how small, adds up. Take the reins. Choose wisely. Filter your choices like your kidneys would if they could. Make your body's job easier, not harder. And I promise you, it will thank you.